I wanted to highlight in this week's Friday vlog, welcome, by the way, one or two changes that have been made in our organisation, changes to clinical practices and ways of working that I think are worth knowing about and I think are worth celebrating. So one of the priorities of both the Clinical Leadership Executive and the Council of Governors is what we might call transitions. In other words, the journey from adolescence into adulthood and the way in which health services often aren't particularly well prepared for that. Either young people or their loved ones experience quite a significant discrepancy between how things have worked in children's services and how they work when one interacts with the NHS as a young adult. Now, that's a real priority for us as an organisation. As a provider of both children and adult services, you'd expect us to be absolutely tremendous at these transitions. And I think the analysis from clinical colleagues and the feedback from patients and carers is that experiences can be a little bit mixed. So each of our care groups, each of our adult-oriented care groups has agreed a priority area for focused work. And we reviewed that just this week in the Clinical Leadership Executive. I wanted to offer a particular shout out to guests and colleagues in talking therapies who have been doing quite a lot of training and development work and are making big changes to the pathway to enable access for people from the age of 16 to services that were previously restricted on a different age basis. And you know from the work we did last year on stripping away some of the barriers that are associated with your 65th birthday, that it's important for us as an organisation to try and move away from things that are not necessarily needs-led and are not necessarily patient-centred. Now, in congratulating colleagues in talking therapies and children's services, I know I haven't mentioned all the other projects that are going on, and I'll look to do that over the next little while. But I know how much effort and passion has gone into that work, but I also know it's really important that over the next year or two, we continue to evaluate the experiences of those young people going through age transition to see whether the changes we've made are really making a difference. Now, next week is a big week. It's a big week because there'll be an announcement related to Promise 11, but it's a particularly big week for colleagues who are working in and around Sandpiper Ward. I wanted to thank the team for being our testbed ward, for the changes in the high quality therapeutic care task force work that we've been talking about in these vlogs a number of times. So you remember in mid-June, we talked about new timetables for how we organise our wards as one of a series of changes associated with culture of care, associated with the College of Psychiatrists accreditation, associated with our own safety plans. So from Monday, the team are going to be piloting that work or testing that work for a period of 4 weeks. But I need to emphasise here that on the working assumption that with some refinements through that test, that what we have had proposed by teams works, we will move very rapidly then to apply those different timetables and ways of working across all of our mental health wards, our PICUs, our acute wards, our older adult wards. It's really important at the heart of our effort to introduce consistency into how we work. But look, thank you to everybody in Sandpiper for being a guinea pig. Clinical Leadership Executive did decide that on the 1st of September, we will move to the new visiting times standardised across our organisation. There'll be more publicity about that as we go through August. But again, introducing consistency into how we try and work as an organisation. And of course, these things are partly in my mind because there's a moment of accountability tomorrow when we have our annual members meeting and we listen to the public about what matters to them, and we also feedback on where we've made progress and where we've still got work to do. I know, for example, in delivering Promise 2, which relates to carers, whether they're young carers or adult carers, we've got a lot of work to do. Made a cracking start with our carers network. But again, the big conversation at the Clinical Leadership Executive this week is about what it will take for us to recognise carers who we work with as patients or in patients' households and make sure that those folk are referred for meaningful support and carers assessments. So there are definitely promises where a little bit slower progress is being made. But of course, there are promises where we are really beginning to get there. Great progress with trying to reduce out-of-area placements. I don't in any way want to jinx it. Really clear commitments from care group directors and SLTs around our 4-week wait promise on Promise 14, in which we've clearly invested a lot of money. But I don't want to spoil the surprise tomorrow at the AMM. We clearly have now met our first promise, which is Promise 25. And I will be confirming that we have now received the official accreditation of the Real Living Wage Foundation. Now, there is more to do in how we approach poverty in our organisation. There is more to do to make sure that anybody who is experiencing financial distress, debt advice, and so on is able to get support. There is more to do to make good on our commitment to provide support for patients from the most disadvantaged backgrounds in terms of travel to receive patient care, which is a key recommendation of many of our Promise 6 poverty proofing reports. But let's be positive at this moment. 27 promises to go. One promise, I think, now solidly delivered. So thank you to everybody, perhaps particularly teams in payroll who've worked so hard to get that into place, and the work we need to do to make our procurement system biased towards local suppliers is work that will continue. Now, talking of success, they give me a prop this week. So this is, if you don't recognise it, is a quick cricket bat. And you'll remember why we're mentioning that, because in addition to the annual members meeting, tomorrow we've got the fun day. Who knows quite what the weather will bring us, but what we do know is that we've got a number of colleagues with us for more distinguished service awards. We've got a group of children and young people who are going to get the board TikTok dancing, and somewhere in that process will also ask us, I think, some very interesting and challenging questions. We've got the quick cricket. Still probably find a way to volunteer. You can throw yourself off an abseil wall in return for a £5. You can throw water at Jude Graham, or if you prefer, at me. We're raising money for charity as well. The prop they should have given me was the alpacas, who I understand will also be with us. Fun day tomorrow. For goodness sake, find a few minutes, come and join us. We'll have a really good time. Chance to celebrate all your hard work and all the efforts of people across the organisation. Thank you so much.